Hey guys, tonight we begin with what might just be the most terrifying profession in human history. And no, I'm not talking about executioners or soldiers. I'm talking about medieval doctors, those well-respected members of society who killed more people than any plague, war, or natural disaster of their time. While you probably think of doctors as healers, the medieval physician was essentially a legalized serial killer with a university degree and society's blessing to experiment on human beings in the most horrifying ways imaginable. So before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. And let me know in the comments where you're tuning in from and what time it is for you. It's always fascinating to see who's joining us from around the world. Now dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. Picture this. You're living in medieval Europe, sometime around 1347. You wake up with a headache. Nothing serious, just the kind of minor ailment that today would send you reaching for some aspirin. But instead of popping a pill, you're about to encounter a man in elaborate robes who will convince you and your family that the best course of action is to drain several pints of your blood, force you to vomit until you're dehydrated, give you mercury to drink, and then, if you're still breathing, apply red-hot irons to various parts of your body. And here's the truly twisted part. He'll charge you handsomely for the privilege. The medieval doctor was operating under a system so fundamentally flawed, so catastrophically wrong about basic human biology, that calling it medicine is like calling a house fire interior decorating. These weren't evil men. Well, most of them weren't. They were products of a system that had taken the worst possible interpretations of ancient Greek and Roman medical texts, mixed them with religious superstition, added a healthy dose of complete ignorance about how the human body actually works, and then gave these walking disasters the authority to perform their gruesome experiments on any desperate enough to seek their help. You're probably thinking that surely some of these treatments must have worked, right? That there must have been some medical advances, some understanding that developed over the centuries. And you'd be partially correct. But here's the thing that makes medieval medicine so uniquely terrifying. The treatments that actually worked were usually the ones that did the least harm. The most common successful medieval medical intervention was literally doing nothing and letting the patient's body heal itself. When medieval doctors got actively involved, when they really started practicing their craft, that's when people started dying in creative and horrible ways. The mortality rate for patients who received proper medical care was often higher than for those who were simply left alone. Imagine being so bad at your job that your patients have a better chance of survival if you don't show up to work. But medieval doctors weren't just incompetent. They were confidently, catastrophically incompetent. They had elaborate theories, complex procedures, and absolute certainty that they were doing the right thing, even as their patients screamed, convulsed, and died in front of them. What makes this even more disturbing is that medieval medicine wasn't some primitive folk healing practiced by village herbalists. This was the pinnacle of medieval science, taught at universities, practiced by learned men who could read Latin and debate theology. These were the intellectuals of their time, the educated elite who would spend years studying the great medical texts of antiquity. And yet, they were systematically torturing and killing people with methods so barbaric that they make modern horror movies look like children's cartoons. The medieval doctor's toolkit reads like a catalog of torture devices. Saws for cutting through bone without anesthesia, hooks for extracting organs through small incisions, elaborate contraptions for stretching and realigning limbs, vats of boiling oil for cleansing wounds, and an entire pharmacy of toxic substances that they administered with the confidence of someone prescribing vitamins. They had specialized knives for different types of cutting, drills for boring holes in skulls, and an impressive array of instruments, designed specifically for causing maximum pain while keeping patients conscious throughout the procedure. But perhaps the most chilling aspect of medieval medicine was how it was received by society. These doctors weren't operating in secret, hiding their activities from the authorities. They were celebrated, well-paid members of the community. Families would spend their life savings to bring in a famous physician, convinced that his reputation and expensive treatments were their loved one's best hope for survival. The more elaborate and expensive the procedure, the more confidence people had in its effectiveness. Pain was considered a necessary part of healing, and if a patient died during treatment, well, that just meant they were too far gone for even the doctor's advanced techniques to save them. The medieval doctor was essentially running a protection racket, except instead of threatening to break your legs if you didn't pay, he was offering to break them for you if you did pay. And people lined up for the privilege, because the alternative, admitting that these learned men with their impressive degrees and elaborate theories didn't actually know what they were doing, was simply unthinkable. Tonight, we're going to explore how this system of legalized murder developed, why it persisted for centuries, and how some of the most intelligent people of their time became unwitting agents of mass death. We'll look at the specific procedures that medieval doctors used, the theoretical frameworks that justified these practices, and the real human cost of a medical system that was more concerned with following ancient texts and with actually helping patients survive their treatments. The crimson currency. When blood was medicine's answer to everything, you wake up in medieval Paris, 1348, and you're feeling dizzy. Maybe you ate something that didn't agree with you, or perhaps you've been working too hard in the fields. It's nothing serious, at least. It wasn't until you made the mistake of mentioning it to your neighbor, who insists you must see the learned physician who recently arrived from the University of Montpellier. You protest that you feel fine now, but your family is already pooling their coins, convinced that proper medical attention is exactly what you need. The physician arrives at your home 3 days later, a man draped in elaborate robes that cost more than your house. He has a pointed beard, carefully maintained, and eyes that seem to look right through you as if you're already dead. He doesn't greet you warmly or ask about your symptoms in detail. Instead, he immediately begins examining your urine, not with any kind of testing equipment, mind you, but by holding the container up to the light, swirling it around, and occasionally taking a small taste. Yes, you read that correctly. Medieval doctors routinely tasted their patients' urine as a diagnostic tool. After this revolting examination, he nods gravely and announces his diagnosis. You have too much blood. Not a blood clot, not high blood pressure, not any condition that actually relates to blood volume or quality. Simply too much blood. According to the medical wisdom of the time, most illnesses were caused by having an excess of one of the 4 bodily fluids, or humors, and blood was by far the most commonly diagnosed culprit. What happens next would be considered assault and battery in any modern court of law, but in medieval times, it was the height of medical sophistication. The doctor opens his leather bag and removes what looks like a small, sharp knife. Except this isn't just any blade. This is a phleem, a specialized bloodletting instrument designed specifically for making precise cuts in human veins. He also pulls out a brass bowl, polished to a mirror shine, which will catch your blood as it flows out of your body. The doctor explains, with the kind of confident authority that only comes from years of formal education, that he needs to remove approximately 1 pint of blood from your system. He's not guessing at this amount. Medieval medical texts provided detailed charts showing exactly how much blood should be removed based on the patient's age, gender, social class, and the phase of the moon. Yes, the phase of the moon was considered a crucial factor in determining how much of your life force should be drained away. You're probably thinking that surely they had some understanding of hygiene, some basic knowledge about preventing infection. You would be wrong. The phleem that's about to cut into your flesh has been used on dozens of other patients without being properly cleaned. The concept of sterilization won't be discovered for another 500 years. The doctor wipes the blade on his robe. The same robe he's been wearing for weeks without washing. and selects a prominent vein in your arm. The cutting begins without any form of pain relief whatsoever. Medieval doctors believed that pain was not only necessary but beneficial to the healing process. They thought that suffering helped purge the body of evil influences, and that numbing the pain would interfere with the treatment's effectiveness. So you feel every bit of the sharp metal slicing through your skin, and you're expected to remain still and grateful for the privilege. As your blood begins to flow into the brass bowl, the doctor watches with the satisfaction of a craftsman admiring his work. He's not monitoring your pulse or checking for signs of shock or blood loss. Instead, he's looking at the color and consistency of your blood, making notes about whether it appears to be the right kind of blood to remove. Medieval medical theory held that there were different types of blood in the body, some good, some bad, and that the skill of the physician lay in knowing which type was flowing out. The amount of blood being removed would horrify any modern medical professional. A pint of blood represents roughly 10% of the total blood volume in an average adult human body. Losing this much blood rapidly causes immediate physiological stress. Your heart rate increases as it struggles to pump the remaining blood through your system. Your blood pressure drops dramatically, and your brain begins to receive insufficient oxygen. You start to feel weak, nauseous, and disoriented. Your skin becomes pale and clammy. To the medieval doctor, these symptoms are proof that the treatment is working. Your weakness is interpreted as evidence that the excess blood, the source of your illness, is being successfully removed. Your pale complexion is seen as a sign that your body's natural balance is being restored. The fact that you're on the verge of passing out doesn't concern him in the slightest. In fact, it's exactly what he expects to see. But here's where medieval bloodletting becomes truly diabolical. If you don't immediately feel better after losing a pint of blood, the obvious solution is to remove more blood. The doctor has brought along additional instruments for more aggressive bloodletting, including cupping glasses, heated glass vessels that create suction when placed against the skin, and leeches, those delightful little creatures that will attach themselves to your body and continue draining blood long after the doctor has left. Cupping was particularly popular because it allowed doctors to remove blood from specific areas of the body. The process involved heating a glass cup, usually by placing a burning piece of cotton inside it, and then quickly pressing the cup against the patient's skin. As the air inside cooled, it created a vacuum that would literally suck the blood up through the pores. The resulting wounds were often infected, always painful, and frequently left permanent scarring. Leeches were considered the gentle option for bloodletting, which should give you some idea of how brutal the other methods were. These slimy creatures would attach themselves to the patient's skin and slowly drain blood, while injecting an anticoagulant that prevented clotting. The problem was that medieval doctors had no real understanding of how much blood leeches were removing, and patients often suffered from continued bleeding long after the leeches were removed. The truly insidious part of bloodletting was how it created a self-reinforcing cycle of medical intervention. Because the treatment made patients weaker and sicker, they naturally required more medical attention. And since medieval medical theory taught that all illness was essentially the same problem, an imbalance of bodily humors, the solution was always more of the same treatment. If bloodletting didn't cure the patient immediately, it obviously meant that not enough blood had been removed. Historical records from medieval hospitals show that some patients underwent bloodletting procedures multiple times per week for months at a time. Their medical bills, yes, medieval medicine was very much a for-profit enterprise, often included charges for dozens of bloodletting sessions, each one making the patient progressively weaker and more susceptible to actual diseases. The economic incentives were perfectly aligned to encourage more bloodletting, not less. Doctors were paid per procedure, not per cure, so a patient who required multiple treatments was more profitable than one who recovered quickly. The more elaborate and frequent the bloodletting, the more impressive the doctor appeared to be, and the more he could charge for his services. Surgery, when screaming was the only anesthesia, you're lying on a rough wooden table in what passes for a medieval operating theater, which is really just a room with good lighting and drainage for all the blood that's about to flow. The year is 1456, and you have a dislocated shoulder from a fall, an injury that today would require a brief, relatively painless procedure to pop the joint back into place. But you're about to discover that medieval surgery was less about precision and more about who could endure the most agony without dying of shock. The surgeon approaches, and the first thing you notice is that he's not wearing gloves. Gloves won't be used in surgery for another 400 years. His hands are stained with blood from previous patients, not just today's patients, but blood that has accumulated over weeks of surgical procedures. He considers these stains a mark of professional experience, like battle scars that prove his expertise. The concept that invisible organisms could cause infection is so far beyond medieval understanding that they actually believe dirty surgical instruments work better than clean ones, because they've been seasoned with use. Your surgeon is holding what appears to be a carpenter's saw, because that's essentially what it is. Medieval surgical instruments were often repurposed tools from other trades, modified slightly for medical use. The saw has been sharpened recently, but not cleaned. The wooden handle is dark with old blood and other fluids that you probably don't want to identify. This saw will be used to cut through your collarbone if the surgeon decides that's the best way to access your dislocated shoulder. But before any cutting begins, you need to be properly restrained. Medieval surgery required several strong men to hold the patient down, because the alternative was having a person in excruciating pain thrashing around while someone tried to perform delicate work with sharp instruments. Thick leather straps are tied around your wrists and ankles, and a wooden bit is forced between your teeth to prevent you from biting your tongue off during the procedure. The surgeon explains his plan in the matter-of-fact tone of someone discussing the weather. He's going to make an incision from your shoulder to your chest, peel back the skin and muscle, locate the displaced joint, and manually force it back into position. If that doesn't work, he'll remove some bone fragments to make more room. The entire procedure should take about an hour, assuming you don't pass out from blood loss or die of shock halfway through. What you're experiencing right now, strapped to this table waiting for unimaginable pain to begin, is actually the most humane part of medieval surgery. Once the cutting starts, there will be no relief, no escape, no mercy. Medieval surgeons believed that consciousness during surgery was not just unavoidable, but actually beneficial. They thought that an unconscious patient was closer to death, and that keeping someone awake and aware proved that they were strong enough to survive the procedure. The first cut is always the worst, because that's when you realize that every story you've heard about medieval surgery being brutally painful was actually an understatement. The saw teeth tear through your skin with the efficiency of a tool designed to cut wood, because that's exactly what it is. Your body's immediate response is to go into shock. Your blood pressure spikes, your heart pounds, and your vision starts to blur from the overwhelming pain. The surgeon interprets your screaming as a positive sign. Medieval medical theory taught that loud expressions of pain helped expel illness from the body, like a form of vocal purging. The more you scream, the more confident he becomes that the surgery is working. Your agony is literally music to his ears, proof that his technique is forcing the evil humors out of your system. As the saw cuts deeper, you discover that medieval surgeons had no understanding of anatomy beyond what they could see with their eyes. They didn't know about nerve pathways, blood vessel locations, or muscle connections. Surgery was basically exploratory butchery. Cut until you find the problem, then cut some more until it looks like it might be fixed. The surgeon is essentially performing autopsy techniques on a living person. The bleeding is catastrophic, but the surgeon expected this. Medieval surgical procedure called for multiple assistants whose primary job was to catch blood in bowls and periodically dump it out when the bowls got full. There's no attempt to stop the bleeding or minimize blood loss. In fact, excessive bleeding was considered therapeutic. just another form of bloodletting that would help balance your bodily humors. When the surgeon finally locates your shoulder joint, he discovers that the dislocation is more complicated than he initially thought. The bone has shifted in a way that requires more extensive cutting to access properly. Without hesitation, he picks up a smaller saw and begins cutting through muscle tissue, working his way closer to the bone. Each cut sends new waves of pain through your body. Pain so intense that you're beginning to understand why many surgical patients simply died of shock before the procedure was complete. Medieval surgical technique relied heavily on improvisation. If the standard approach wasn't working, surgeons would simply try something else, using the patient's body as a testing ground for new ideas. Your surgeon decides that the best way to realign your shoulder is to cut through the surrounding ligaments and manually reconstruct the joint from scratch. This means several more minutes of cutting, followed by the excruciating process of having your bones manipulated by someone with no real understanding of how joints are supposed to function. The manual manipulation is arguably worse than the cutting. The surgeon grabs your arm with his blood-slicked hands and begins pulling and twisting, trying to force the displaced bone back into its socket. Medieval surgeons believed that more force was always better than less force, so he's not being gentle. He's pulling with enough strength to potentially break bones, twist ligaments beyond repair, or cause permanent nerve damage. Throughout this ordeal, you're expected to provide feedback to the surgeon. Medieval surgical practice included having patients describe their pain levels and sensations during the procedure, because this was considered crucial diagnostic information. The surgeon wants to know if you feel burning, tearing, crushing, or stabbing sensations, because each type of pain supposedly indicated different things about what was happening inside your body. The reconstruction phase of your surgery involves the surgeon essentially rebuilding your shoulder joint based on his best guess about how it should look. He has no x-rays, no detailed anatomical knowledge, and no way to see inside your body except by cutting it open. He's working entirely by feel, trying to arrange bones and muscles in configurations that seem reasonable to him. After what feels like hours of cutting, pulling, and manipulation, the surgeon announces that the joint has been successfully realigned. Your shoulder certainly feels different, mainly because several muscles have been severed and multiple bones have been fractured during the reconstruction process. But according to medieval surgical standards, the procedure has been a complete success. The final phase involves closing the wound, which presents its own set of medieval horrors. The surgeon uses thick thread made from animal intestines to stitch your flesh back together, pulling the edges of the incision tight without regard for how the underlying tissues will heal. Medieval surgical closure was purely cosmetic. They wanted the wound to look sealed from the outside, regardless of what was happening internally. The four humors, when medical theory was based on ancient nonsense. You're sitting in the consultation chamber of a medieval physician in 1389, and he's about to explain to you the fundamental principles of medical science that will determine whether you live or die. What you're about to hear is a theory so completely divorced from reality, so magnificently wrong about basic human biology, that it's almost impressive in its comprehensive ignorance. Yet this theory will guide medical practice for over 1,000 years, and kill more people than any single disease in human history. The doctor, resplendent in his academic robes and speaking with the authority of someone who has memorized every word of ancient medical texts, begins his explanation. Your body, he tells you, contains four essential fluids called humors: blood, phlegm, yellow bile, and black bile. The balance of these four humors determines not just your physical health, but your personality, your intelligence, your moral character, and your destiny. Too much blood makes you violent and lusty. Too much phlegm makes you sluggish and cowardly. Too much yellow bile makes you angry and ambitious. Too much black bile makes you depressed and artistic. This sounds like medieval astrology, and in many ways, it is. The four humors theory was directly connected to the four elements: earth, air, fire, water, the 4 seasons, the 4 ages of man, and the 4 temperaments. Medieval medicine was less about treating disease and more about maintaining cosmic harmony within the human body. You weren't just sick, you were cosmically unbalanced, out of alignment with the fundamental forces of the universe. The physician pulls out an elaborate chart showing the relationships between different humors, body parts, planets, and zodiac signs. Your spleen, he explains, produces black bile and is governed by Saturn. Your liver produces yellow bile and is governed by Mars. Your brain produces phlegm and is governed by the moon. Your heart produces blood and is governed by Jupiter. Disease occurs when these planetary influences become unbalanced, usually because you've been eating the wrong foods, living in the wrong climate, or failing to properly regulate your emotional state. What makes this theory particularly dangerous is how it explains away treatment failures. If bloodletting doesn't cure your headache, it's not because bloodletting is ineffective, it's because you have too much of a different humor that needs to be addressed. Maybe you need to vomit up the excess phlegm, or purge the yellow bile through your bowels, or have the black bile drained through special procedures. The theory is self-reinforcing. Every failed treatment just proves that the patient needs more aggressive intervention to restore humoral balance. The diagnostic process, based on humoral theory, was elaborate and completely useless. The physician examines your urine not just by looking and tasting, but by noting its color, consistency, smell, and the way it settles in the container. Different combinations of these factors indicate different humoral imbalances. Clear urine means too much phlegm. Dark urine means too much black bile. Cloudy urine means too much blood. Sweet-tasting urine means too much yellow bile. The fact that sweet urine actually indicates diabetes, a serious medical condition, was completely unknown to medieval medicine. Your pulse is analyzed not for its rate or rhythm, but for its quality. A hard pulse indicates too much yellow bile. A soft pulse indicates too much phlegm. A rapid pulse indicates too much blood. A weak pulse indicates too much black bile. The physician places his fingers on your wrist and nods sagely as he feels. What he believes are the cosmic forces of your humoral balance expressing themselves through your heartbeat. The examination includes detailed questions about your dreams, because medieval medicine believed that sleep visions revealed the true state of your humoral balance. Dreams about fire indicate excess yellow bile. Dreams about water indicate excess phlegm. Dreams about blood or violence indicate excess blood. Dreams about darkness or death indicate excess black bile. The physician takes careful notes about your dream life, creating what he believes is a psychological profile that will guide your treatment. Your diet is scrutinized according to humoral properties of different foods. Meat is considered hot and moist, which increases blood production. Fish is cold and moist, which increases phlegm. Spicy foods are hot and dry, which increases yellow bile. Dairy products are cold and wet, which also increases phlegm. The physician creates an elaborate dietary plan designed to counteract your perceived humoral imbalances, usually by forbidding you to eat most of the foods you actually enjoy. The treatment plan that emerges from this humoral analysis is a nightmare of medieval medical intervention. Since your examination has revealed, surprise, that you have too much blood, you'll need regular bloodletting sessions. Since you also apparently have excess yellow bile, you'll need to take medicines that cause violent vomiting. Since your dreams suggest some phlegm imbalance, you'll need nasal purging procedures that involve snorting irritating substances until you produce enormous amounts of mucus. But the humoral theory goes deeper than just physical treatments. Your behavior, your emotions, and your moral character are all considered medical issues that require intervention. If you're angry too often, you have excess yellow bile and need cooling treatments. If you're sad too frequently, you have excess black bile and need warming treatments. If you're too passionate or lustful, you have excess blood and need draining treatments. Medieval medicine was essentially attempting to regulate human personality through brutal physical interventions. The seasonal aspect of humoral medicine meant that your treatments changed based on the time of year. Spring was associated with blood, so spring treatments focused on bloodletting and dietary restrictions. Summer was associated with yellow bile, so summer treatments emphasized purging and cooling procedures. Fall was associated with black bile, so autumn treatments involved warming medicines and mood-regulating substances. Winter was associated with phlegm, so winter treatments concentrated on drying agents and respiratory interventions. The social implications of humoral theory were equally destructive. Different social classes were believed to have different humoral compositions, which justified treating peasants differently from nobles. Women were thought to be naturally colder and moister than men, which explained why they received different medical treatments and were considered inherently inferior. Children were believed to be naturally hot and moist, which justified treating them with cooling procedures that often killed them. The economic incentives built into humoral medicine were perfectly designed to maximize both treatment duration and physician income. Since achieving perfect humoral balance was theoretically possible, but practically impossible, patients required ongoing medical supervision indefinitely. The physician could always find some slight imbalance that needed correction, some dietary adjustment that needed monitoring, some seasonal treatment that needed modification. Plague doctors. Death in a bird mask. You're living in Florence, 1348. And the Black Death has arrived with the efficiency of a medieval apocalypse. Bodies are piling up in the streets faster than they can be buried. Entire families are dying within days of each other, and the normal structure of society is collapsing under the weight of mass death. Into this nightmare walks a figure so terrifying that he seems like a hallucination brought on by fever. The plague doctor, dressed in a long black robe and wearing a leather mask with a grotesquely elongated beak, looking like a giant crow that has decided to walk upright and practice medicine. The plague doctor's costume isn't just theatrical. It's based on medieval medical theory about how diseases spread. The long beak contains aromatic herbs and spices that are supposed to purify the air before it reaches the doctor's lungs. Medieval medicine believed that diseases like the plague were caused by miasma, bad air filled with evil vapors that could corrupt the body's humoral balance. The beak was essentially a primitive gas mask designed to filter out the poisonous atmosphere that surrounded plague victims. But here's what makes the plague doctor so uniquely terrifying. His treatments were often worse than the disease itself. The plague killed about 60% of the people who contracted it. The plague doctor's treatments killed about 90% of the people who received them. You had a better chance of surviving the Black Death by hiding in your house and hoping for the best than by seeking professional medical attention. When the plague doctor arrives at your door, responding to desperate pleas from your family, he brings with him a leather bag filled with instruments that look like they were designed by someone who had only heard descriptions of medical equipment secondhand. There's a long metal rod for examining patients without getting too close, various knives for making incisions, and bottles filled with substances that would be illegal to possess in a modern hospital. The plague doctor's diagnostic process is both elaborate and completely useless. He approaches your plague-stricken family member while maintaining as much distance as possible, using his metal rod to poke and prod the patient. He's looking for buboes, the characteristic swellings that appear in the lymph nodes of plague victims. When he finds them, he nods with grim satisfaction because he knows exactly what needs to be done. The standard treatment for plague buboes was to lance them with a knife, releasing the infected fluid inside. This sounds almost reasonable until you realize that medieval plague doctors had no understanding of infection control, sterile technique, or proper wound care. The knife used to lance one patient's buboes was immediately used on the next patient without any cleaning whatsoever. Plague doctors were essentially spreading the disease from patient to patient while believing they were curing it. The pus and infected fluid that drained from lanced buboes was considered medically valuable. Medieval theory taught that diseases were caused by corrupt humors that needed to be expelled from the body. So the more disgusting fluid that came out of a patient, the more successful the treatment was considered to be. Plague doctors would sometimes collect this infected drainage and use it as an ingredient in medicines for other patients. But lancing buboes was just the beginning of plague treatment. Medieval medicine demanded a comprehensive approach to rebalancing the patient's humors, which meant combining multiple deadly procedures into a single treatment regimen. After lancing the buboes, the plague doctor would typically perform bloodletting to remove the corrupt blood that was causing the disease. Plague patients, already weakened by high fever and systemic infection, would have several pints of blood removed through various methods. The bloodletting was followed by purging, forced vomiting, and diarrhea induced by poisonous substances, designed to expel the disease through the digestive system. Plague patients were given mercury, arsenic, and other toxic metals mixed into various concoctions that caused violent gastrointestinal reactions. The theory was that the plague needed to be purged from all possible body openings: blood from the veins, vomit from the stomach, diarrhea from the intestines, and pus from the lanced buboes. Some plague doctors specialized in cauterization, burning infected areas with red-hot irons to cleanse them of disease. This process involved heating metal instruments over an open flame until they glowed red, then pressing them against the patient's buboes, open sores, or any other area that looked infected. The screaming that resulted from this procedure was considered a positive sign that the treatment was working effectively. The most sadistic plague treatments involved trepanation, drilling holes in the patient's skull to release the evil vapors that were supposedly causing the disease. Medieval plague doctors believed that the disease created pressure inside the head that needed to be relieved through surgical intervention. Using tools that were essentially carpenter's drills, they would bore holes through the patient's skull while the patient remained fully conscious. Because anesthesia didn't exist and wouldn't be invented for another 500 years. The psychological torture of plague treatment was almost as bad as the physical torture. Plague doctors worked under the assumption that the disease was divine punishment for sin. So patients were subjected to lengthy moral lectures about their spiritual failings while undergoing medical procedures. They were told that their suffering was necessary for salvation, that the pain of treatment was purifying their souls, and that survival depended on maintaining proper religious devotion throughout the ordeal. The economic aspects of plague medicine were particularly cruel. Families would spend their entire life savings on treatments that were guaranteed to make their loved ones suffer more before dying. Plague doctors charged premium rates during epidemics, knowing that desperate people would pay any amount for the hope of survival. The more elaborate and expensive the treatment, the more confidence families had in its effectiveness. Many plague doctors developed elaborate rituals around their treatments, partly for psychological effect and partly because they genuinely believed that ceremony was medically important. They would burn incense, recite Latin prayers, arrange the patient's body in specific positions, and time their procedures according to astrological calculations. These rituals added hours to treatments that were already excruciating ordeals of pain and terror. The plague doctor's record-keeping was meticulous, but focused entirely on the wrong things. They kept detailed notes about the color and consistency of blood removed from patients, the volume of vomit produced during purging, the appearance of pus from lanced buboes, and the patient's behavior during cauterization. They recorded everything except the most important information, whether their treatments actually helped patients survive. The social impact of plague doctors extended far beyond their medical practice. Their presence in a community was often seen as a sign that God had abandoned the area, that death was inevitable, and that normal social rules no longer applied. The sight of a plague doctor walking through the streets, with his inhuman bird mask and black robes, was enough to cause panic among healthy people and despair among those who were already sick. Herbal remedies that were actually slow-acting poisons. You're browsing through a medieval apothecary shop in 1423, and the scene looks almost quaint. Shelves lined with jars of dried herbs, bundles of plants hanging from the ceiling, and a learned herbalist who speaks knowledgeably about the healing properties of various botanical preparations. This feels like a safe alternative to the brutal bloodletting and surgical procedures that pass for mainstream medicine. You're about to discover that medieval herbal medicine was often just as deadly as any other medical treatment, but with the added horror of killing patients slowly over weeks or months. The apothecary greets you with the confidence of someone who has spent years studying the medical properties of plants, and his knowledge is genuinely impressive. He can identify hundreds of different herbs, explain their traditional uses, describe the proper methods for preparing them, and provide detailed instructions for dosage and administration. What he doesn't know, what nobody in medieval Europe knows, is that many of these healing herbs contain compounds that are violently toxic to human beings. You mentioned that you've been having trouble sleeping, and the apothecary immediately recommends a preparation made from henbane, a plant with beautiful purple flowers that was commonly used as a sedative in medieval medicine. What he doesn't tell you, because he doesn't know, is that henbane contains tropane alkaloids, the same compounds used in modern truth serums and criminal poisoning cases. The difference between a therapeutic dose and a lethal dose is so small that it's essentially impossible to measure using medieval techniques. The henbane preparation is mixed with wine to make it more palatable, and the apothecary explains that you should take it every night before bed until your sleep problems resolve. What happens next is a slow descent into what can only be described as a chemically induced nightmare. The first few doses make you drowsy, which seems like exactly what you wanted. But henbane doesn't just cause sleepiness. It causes hallucinations, delirium, and gradual nervous system damage. After a week of taking your medicine, you start experiencing vivid, terrifying dreams that continue even after you wake up. Your vision becomes blurry, your speech becomes slurred, and you develop an uncontrollable urge to remove your clothes, which is a characteristic symptom of henbane poisoning. But when you return to the apothecary to report these problems, he congratulates you on the effectiveness of the treatment. According to medieval medical theory, these symptoms prove that the herb is successfully purging the evil humors that were causing your sleep difficulties. The apothecary increases your dosage and adds another herb to the mixture, mandrake, a plant with a long history in medieval medicine and an even longer history of killing people who used it. Mandrake contains similar alkaloids to henbane, but in higher concentrations and with additional compounds that affect the cardiovascular system. Medieval herbalists believed that mandrake was particularly effective because of its human-shaped root, which they interpreted as a sign that the plant was specially created to heal human ailments. Your condition deteriorates rapidly under this new treatment regimen. The combination of henbane and mandrake creates a synergistic toxic effect that attacks multiple organ systems simultaneously. Your heart rate becomes irregular, your blood pressure fluctuates wildly, and you begin having seizures. But medieval medical theory interprets these symptoms as evidence that the treatment is working more effectively, that the herbs are successfully battling the spiritual forces that were causing your original illness. The apothecary decides that your case requires more aggressive herbal intervention, so he adds mercury to your preparation. Medieval medicine considered mercury to be the ultimate purifying agent, capable of cleansing the body of any corrupt influence. What actually happens when you ingest mercury is systematic poisoning of your nervous system, kidneys, and brain. Medieval patients who received mercury treatments typically developed tremors, memory loss, personality changes, and eventually died of organ failure. But mercury poisoning takes time to kill, and during that time, patients often experience periods where they felt slightly better. Medieval herbalists interpreted these temporary improvements as proof that the mercury was working, that the patient just needed more time and higher doses to achieve a complete cure. They had no understanding of the difference between temporary symptom relief and actual healing, so they continued poisoning patients while believing they were saving their lives. Your mercury-enhanced herbal preparation is now causing symptoms so severe that you can barely function. You're experiencing constant nausea, violent headaches, difficulty speaking, and problems with coordination. Your family becomes concerned and seeks a second opinion from another apothecary, who examines your condition and immediately identifies the problem. You're obviously not getting enough of the active ingredients. The second apothecary recommends adding wolfsbane to your treatment regimen. Wolfsbane, also known as aconite, was one of the most popular herbs in medieval medicine and one of the most reliably lethal plants in Europe. It contains aconitine, a compound so toxic that a few drops can cause cardiac arrest in a healthy adult. Medieval herbalists used wolfsbane to treat everything from headaches to depression, completely unaware that they were essentially administering a fast-acting poison. The addition of wolfsbane to your already toxic herbal mixture creates what amounts to a perfect storm of plant-based poisons. The aconitine attacks your cardiovascular system. The mercury continues destroying your nervous system. And the henbane and mandrake maintain their assault on your brain and organs. You're now taking a combination of substances that would be classified as weapons of mass destruction if they were used in warfare. Your physical condition has deteriorated to the point where you can no longer walk without assistance, speak coherently, or control your bodily functions. But according to medieval herbal medicine theory, these symptoms indicate that the treatment is reaching its most effective phase. The herbalists explain that you're experiencing a healing crisis, a period of intense symptoms that proves the herbs are successfully purging the deepest levels of spiritual corruption from your body. The final addition to your herbal treatment is antimony, a metallic element that medieval alchemists believed could transmute base metals into gold and base illnesses into perfect health. Antimony is a cumulative poison that causes gradual organ failure, beginning with the liver and kidneys and eventually affecting every system in the body. Medieval physicians often prescribed antimony for chronic conditions because it seemed to produce dramatic results, mainly because it was slowly killing the patient. The combination of antimony with your existing herbal poisons creates a chemical cocktail that would challenge the detoxification abilities of a modern hospital equipped with advanced life support systems. You're medieval herbalists working with no understanding of toxicology, no knowledge of chemical interactions, and no ability to measure precise dosages, have essentially created a slow-acting murder weapon disguised as medicine. Throughout this process of systematic poisoning, your herbalists maintain detailed records of your symptoms, your responses to different treatments, and the various modifications they make to your prescriptions. These records are considered valuable medical data that will help them treat future patients more effectively. They have no way of knowing that what they're actually documenting is a case study in how to kill someone gradually using commonly available plants. Dental torture and the art of bone breaking. You wake up in medieval England, 1467, with a toothache that's been bothering you for several days. In the modern world, this would mean a trip to the dentist, perhaps a prescription for antibiotics, and maybe a simple filling or extraction performed under local anesthesia. In medieval times, this means you're about to experience some of the most creative forms of torture ever devised by human beings, performed by practitioners who combine complete ignorance of dental anatomy with unlimited confidence in their primitive techniques. The medieval dental practitioner you're about to visit isn't technically a doctor. He's usually a barber, blacksmith, or general tradesman who's decided to add tooth pulling to his list of services. There are no dental schools, no licensing requirements, and no standardized procedures. Your dentist learned his craft by watching other people yank teeth out of screaming patients. And he's developed his own creative modifications to traditional techniques based on what tools he happens to have available. When you arrive at his shop, you immediately notice that it doubles as a blacksmith's forge. This isn't a coincidence. Many medieval dental procedures required heating metal tools to red-hot temperatures, and the blacksmith's equipment was perfectly suited for preparing the instruments of dental torture. The air smells of hot metal, burning coal, and something organic that you really don't want to identify, but probably represents the residue of previous patients. The dental practitioner examines your aching tooth using the medieval diagnostic method of jamming various metal implements into your mouth and poking around until you scream. He has no understanding of tooth structure, no knowledge of dental nerves, and no ability to determine whether your toothache indicates a simple cavity or a serious infection. His diagnostic process consists entirely of identifying which tooth hurts when he hits it with a hammer. After this thorough examination, he announces his professional opinion. The tooth needs to be removed immediately, before the corruption spreads to other parts of your mouth. Medieval dental theory held that tooth pain was caused by evil worms that lived inside the teeth, eating away at the structure from within. The only way to stop these dental worms was to extract the entire tooth, destroying their habitat and preventing them from migrating to neighboring teeth. The extraction procedure begins with restraint. Medieval dental work required several strong men to hold the patient down, because the alternative was having someone in excruciating pain thrashing around while sharp instruments were being used inside their mouth. Thick leather straps are tied around your arms and legs, and a wooden block is forced between your jaws to keep your mouth open. You're positioned so that your head is tilted back at an angle that gives the practitioner maximum access to your teeth, while making it impossible for you to see what's happening. The tools used for medieval tooth extraction were essentially modified blacksmith's equipment. The primary instrument was a dental key, a T-shaped device that worked like a lever, with one end inserted under the tooth and the other end used to apply tremendous pressure. The dental key was designed to grip the tooth firmly and then twist it back and forth until the roots broke free from the jawbone. The amount of force required often fractured the surrounding bone and damaged adjacent teeth. But before the extraction can begin, the medieval practitioner needs to prepare the tooth using a technique called cauterization. This involves heating a metal probe over the forge until it glows red hot, then inserting it directly into the cavity in your tooth. The theory is that the extreme heat will kill the dental worms and make the tooth easier to remove. The reality is that you're experiencing what can only be described as having your nerve endings branded with a red-hot iron. The cauterization process typically takes several minutes, during which the practitioner repeatedly heats the probe and inserts it into different parts of your tooth. Each insertion causes pain so intense that you lose consciousness briefly, only to be revived by the smell of your own burning tissue. The practitioner considers your screaming and convulsions to be positive signs that the procedure is working effectively, that the dental worms are being successfully destroyed by the heat. After the cauterization, the actual extraction begins. The dental key is positioned around your tooth, and the practitioner begins applying pressure, rocking the tooth back and forth to loosen it from its socket. Medieval dental extraction was less about surgical precision and more about brute force. The practitioner simply pulled and twisted until something gave way, whether it was the tooth, the surrounding bone, or the patient's ability to remain conscious. The extraction process often removes not just the targeted tooth, but fragments of neighboring teeth, pieces of jawbone, and portions of gum tissue. Medieval practitioners had no way to perform selective extractions, so they simply removed whatever came loose during the procedure. If adjacent teeth were damaged during the extraction, they would be removed as well, on the theory that damaged teeth were more susceptible to dental worms. But tooth extraction was only one aspect of medieval dental torture. Practitioners also offered services for realigning teeth that were growing in crooked positions. This process involved using pliers to physically bend teeth into different positions, usually fracturing the roots in the process. The pain was indescribable, and the results were typically worse than the original problem. But medieval patients were convinced that straight teeth were worth any amount of suffering. Medieval orthodontics also included procedures for closing gaps between teeth. The practitioner would tie adjacent teeth together with wire, then gradually tighten the wire over several weeks until the teeth were forced together. This process often caused the teeth to die from lack of blood circulation. But medieval dental theory taught that dead teeth were better than gap teeth because they were less susceptible to dental worms. The most horrifying aspect of medieval dental practice was the treatment of jaw injuries. Broken jaws were repaired by drilling holes through the bone and threading wire through the holes to hold the pieces together. This surgery was performed without anesthesia, using tools that were basically modified carpentry equipment. The patient remained conscious throughout the procedure, feeling every drill bit as it bored through their jawbone. Medieval dental practitioners also offered cosmetic services, including tooth whitening procedures that involved scrubbing the teeth with abrasive substances that stripped away the enamel. The whitening agents were typically acidic compounds that permanently damaged the tooth structure, making the teeth more susceptible to decay and infection. But the immediate cosmetic results were impressive enough to convince patients that the treatment was worth the long-term damage. Pain management in medieval dentistry consisted entirely of getting the patient extremely drunk before beginning the procedure. Alcohol was the only anesthetic available, and practitioners would often give patients enough wine or ale to cause alcohol poisoning, on the theory that an unconscious patient was easier to work on than a conscious one. Many patients died from alcohol overdose before the dental procedure even began. Religious medicine versus science. When prayer was the prescription, you're lying in the infirmary of a medieval monastery in 1398, and your fever has been climbing steadily for 3 days. The monk physicians who run this hospital represent what medieval society considered the most advanced, enlightened approach to medical care. These are learned men who can read Latin, have studied the great medical texts of antiquity, and combined scientific knowledge with spiritual wisdom. What you're about to experience is how medieval medicine became exponentially more dangerous when filtered through religious doctrine that prioritized the soul's salvation over the body's survival. Brother Augustine approaches your bedside, carrying a leather-bound book that contains the monastery's complete medical knowledge, a combination of ancient Greek texts, Roman surgical manuals, and religious commentaries that attempt to reconcile medical practice with Christian theology. The result is a medical philosophy that treats every illness as a spiritual test, every symptom as a moral failing, and every treatment as an opportunity for religious instruction. The examination begins not with checking your pulse or temperature, but with a detailed interrogation about your spiritual condition. When did you last confess your sins? Have you been having impure thoughts? Are you maintaining proper devotion to the saints? The monk physician explains that your fever is obviously a manifestation of spiritual corruption, and that effective treatment must address the moral causes of your illness before attempting any physical interventions. Medieval religious medicine operated under the assumption that God directly controlled every aspect of human health. Illness was divine punishment for sin. Recovery was divine reward for proper faith. And medical treatment was essentially a form of prayer made manifest through physical procedures. This meant that the effectiveness of any treatment depended more on the patient's spiritual state than on the treatment's actual medical properties. Your confession is recorded in detail because the monk physician needs to understand exactly which sins are causing your fever. Different types of sins were believed to cause different types of illness. Sins of pride caused headaches and eye problems. Sins of lust caused fevers and skin conditions. Sins of gluttony caused digestive problems. Sins of wrath caused heart conditions and high blood pressure. Your fever indicates that you've been committing sins of lust, even if you don't remember doing so. The treatment prescribed for your spiritually caused fever is a combination of physical penance and medical intervention. You'll need to fast for 7 days to purge the lustful desires from your system, undergo daily flagellation to physically punish your sinful flesh, and take a series of herbal preparations, blessed by the monastery's relics, to spiritually cleanse your corrupted humors. The fasting regimen is particularly brutal because you're already weakened by fever. Medieval religious medicine taught that denying the body's physical needs would force the soul to rely more heavily on divine grace, which would accelerate the healing process. You're allowed only water blessed by the monastery's priest, and even this is rationed to prevent you from taking too much pleasure in drinking. The daily flagellation sessions are conducted by Brother Marcus, a specialist in corporal punishment, who has developed elaborate techniques for inflicting maximum pain without causing death. Using a leather whip embedded with small metal pieces, he systematically beats your back, legs, and arms while reciting prayers for your spiritual purification. The monastery's medical theory teaches that each lash drives out specific sins. So the beating continues until Brother Marcus is satisfied that your lustful desires have been adequately punished. The herbal preparations you're given have been blessed by relics of various saints, who were known for their ability to cure specific ailments. Your fever medicine has been blessed by the finger bone of Saint Blaise, who was martyred by having his flesh scraped off with iron combs. The theory is that the saint's suffering has imbued the medicine with special healing properties that will be transferred to your body when you consume it. But the blessing process doesn't just make the medicine more effective. It also makes it more dangerous to refuse. Medieval religious medicine taught that rejecting blessed treatments was equivalent to rejecting God's grace, which could result in eternal damnation. Even if the medicine tastes horrible, causes violent side effects, or makes you feel worse, you're required to continue taking it as an act of faith. The monastery's approach to surgery combines medical ignorance with religious fanaticism in ways that are almost impossible to imagine. When your fever leads to an abscess that needs to be drained, the monk surgeon begins the procedure with an hour-long prayer service asking for divine guidance. The surgical instruments are blessed with holy water. The incision site is marked with the sign of the cross, and the operation is performed while chanting Latin hymns. The religious aspects of the surgery are considered more important than the technical aspects. If the patient screams during the procedure, it's interpreted as demons being expelled from the body. If the patient passes out, it's seen as the soul temporarily departing to receive divine instruction. If the patient dies, it's evidence that God has called them home to eternal reward. There's literally no possible outcome that would be interpreted as evidence that the treatment was ineffective. Medieval monastery hospitals also practiced a form of medical treatment called relic therapy, which involved placing sacred objects on or near the patient's body to transfer healing power. You're given a schedule for rotating different relics across your fever-racked body: a piece of St. Lawrence's gridiron for your back, a fragment of St. Sebastian's arrow for your chest, a splinter from the true cross for your forehead. Each relic must remain in contact with your skin for precisely calculated periods, based on astrological calculations and religious calendars. The psychological aspects of religious medical treatment were often more torturous than the physical procedures. Patients were required to confess every sinful thought that entered their minds during treatment, because impure thoughts could interfere with the healing process. Monks would sit beside your bed, asking detailed questions about your sexual fantasies, violent impulses, and heretical doubts. Recording everything in case it provided clues about why your treatment wasn't working. The monastery's medical library contained detailed descriptions of how different saints had been martyred, because these accounts were considered medical textbooks for treating similar conditions. Saint Agatha had her breasts cut off, so she was invoked for treating breast cancer. Saint Lucy had her eyes gouged out, so she was petitioned for eye problems. Saint Bartholomew was skinned alive, so he was called upon for skin conditions. Your fever treatment includes readings from the lives of saints who died from fever-like illnesses, on the theory that their spiritual example will inspire your body to heal itself. The economic aspects of religious medicine were particularly exploitative because they combined medical fees with religious donations. Families were expected to pay not just for the medical treatment, but for the prayers, the blessings, the relic rentals, and the spiritual counseling that accompanied it. The more expensive the treatment, the more effective it was considered to be. because costly sacrifices demonstrated greater faith in God's healing power. The most dangerous medical procedures known to medieval man. You're about to witness the medieval medical procedures that killed patients with such reliable efficiency that they became the preferred methods for eliminating political enemies who needed to die slowly while maintaining the appearance of receiving medical care. These weren't experimental treatments or desperate last resorts. These were the standard, accepted procedures that medieval physicians used with complete confidence, unaware that they were essentially performing elaborate forms of execution disguised as healing. The year is 1445, and you're observing a procedure called couching being performed on a patient with cataracts. The theory behind couching sounds almost reasonable. Use a sharp needle to push the clouded lens in the eye down into the vitreous cavity, allowing light to enter the eye again. What actually happens is that a medieval physician inserts a large needle directly through the white of the patient's eye, without any form of anesthesia, and begins stabbing around inside the eyeball, trying to dislodge the cataract by feel alone. The patient is held down by several assistants while the physician works, because the natural response to having a needle inserted into your eye is to thrash around violently. The physician has no understanding of eye anatomy, no knowledge of sterile technique, and no way to see what he's doing inside the eye. He simply pokes around with the needle until something moves, then declares the procedure successful. The infection rate approaches 100%, and most patients lose the eye entirely within a few weeks. But couching seems gentle compared to the medieval treatment for kidney stones, a procedure so brutal that many patients beg to be allowed to die rather than undergo the operation. The lithotomy, or cutting for the stone, involved making a deep incision between the patient's legs, manually reaching into the wound to locate the bladder, cutting through the bladder wall, and then fishing around inside with various instruments, trying to extract stones by feel. The lithotomy was performed without anesthesia, with the patient strapped to a special table designed to hold them in position while they screamed. The mortality rate was approximately 90%, not from the kidney stones themselves, but from the surgical procedure designed to remove them. Most patients died of shock during the operation, blood loss immediately afterward, or infection within a few days. The few who survived were typically left permanently incontinent and unable to walk properly. Medieval brain surgery represents perhaps the pinnacle of confident ignorance in medical history. Trepanation, drilling holes in the skull, was prescribed for headaches, mental illness, epilepsy, and any condition that physicians thought might be caused by pressure inside the head. The procedure involved using a hand-crank drill to bore through the patient's skull while they remained fully conscious, because medieval physicians believed that unconscious patients were more likely to die during surgery. The trepanation process could take hours, as the physician slowly drilled through multiple layers of bone, periodically stopping the clean blood and bone fragments out of the hole. Patients often died of shock before the procedure was complete, but if they survived the drilling, they then faced the risk of massive brain infection, as bacteria from the non-sterile instruments were introduced directly into their cranial cavity. Perhaps even more horrifying was the medieval treatment for hernias, which involved castrating the patient to prevent the hernia from recurring. Medieval surgical theory taught that hernias were caused by excessive sexual activity that weakened the abdominal muscles. So the logical solution was to remove the patient's ability to engage in sexual activity. The castration was performed using red-hot knives to seal the wound and prevent bleeding, creating a procedure that combined the worst aspects of surgery, torture, and mutilation. The hernia operation typically began with the patient being given large quantities of alcohol, not for pain relief, but to make them more compliant during the procedure. Once sufficiently intoxicated, they were strapped to a table and the surgeon began cutting. The combination of alcohol-impaired blood clotting, massive tissue damage, and inevitable infection meant that most hernia patients died within a week of their surgery. Medieval obstetrics deserves special mention as perhaps the most consistently lethal branch of medieval medicine. The standard treatment for difficult childbirth was to reach into the birth canal with sharp hooks and literally tear the baby apart piece by piece, then extract the fragments manually. This procedure, called embryotomy, was performed without any consideration for the mother's survival. The goal was simply to remove whatever was blocking the birth canal, regardless of the damage caused in the process. The instruments used for embryotomy looked like torture devices, because that's essentially what they were. Sharp hooks for grabbing and tearing, bone cutters for severing limbs, and specialized knives for decapitating babies while they were still inside the mother. The procedures were performed by male physicians who had no practical experience with childbirth and often no understanding of female anatomy beyond what they had read in ancient texts. Medieval treatment for broken bones involved a procedure called reduction that consisted of grabbing the broken limb and pulling on it until the bones appeared to be aligned properly. There was no understanding of how bones actually healed, no knowledge of proper immobilization techniques, and no recognition that many fractures required surgical intervention to heal properly. Patients with broken arms or legs were simply stretched on primitive racks until their bones appeared straight, then left to heal in whatever position they ended up in. The bone-setting process often caused additional fractures, permanent nerve damage, and chronic pain that lasted for the rest of the patient's life. Many medieval bone-setting patients were left permanently disabled, unable to use their limbs properly, and in constant pain from improperly healed fractures and damaged nerves. Medieval treatment for mental illness involved procedures that make modern psychiatric treatment look like a day at the spa. Patients with depression, anxiety, or other mental health conditions were subjected to shock therapy that involved dropping them into freezing water, spinning them on rotating devices until they lost consciousness, and subjecting them to loud noises and bright lights designed to jar their minds back to normal functioning. The most extreme mental health treatment was skull boring, drilling holes in the patient's head to release the evil spirits that were supposedly causing their mental illness. This procedure had a mortality rate approaching 100%, but medieval physicians continued performing it because they occasionally observed temporary improvements in patients' behavior immediately before they died. The Bloody Legacy: How Medieval Medicine Finally Evolved Beyond Murder. You're standing in a London hospital in 1543, witnessing what historians would later recognize as the final days of medieval medicine's thousand-year reign of terror. The scene before you represents both the culmination of medieval medical ignorance and the beginning of a revolution that would eventually transform medicine from a form of legalized murder into something resembling actual healing. But the transition won't be gentle, and the medieval medical establishment won't surrender its lucrative practice of systematic torture without a fight that will last for centuries. The physician you're observing, Dr. William Thornton, represents the old guard of medieval medicine. He spent 30 years perfecting his techniques of bloodletting, humoral balancing, and surgical intervention, building a reputation as one of London's most skilled medical practitioners. His success is measured not by how many patients survive his treatments, but by how closely his procedures follow the ancient texts and how much his wealthy clients are willing to pay for his services. Dr. Thornton is treating a patient with what we would now recognize as pneumonia, but his diagnosis is based entirely on medieval humoral theory. The patient has too much blood, obviously, because his face is flushed with fever. He also has excess phlegm, clearly, because he's coughing up mucus. The treatment plan involves removing 2 pints of blood, administering mercury to purge the excess phlegm, and applying hot irons to the patient's chest to burn out the corrupt humors that are causing the illness. But something unprecedented is happening in Dr. Thornton's hospital. A young physician named Thomas Hartwell has returned from studying at the University of Padua, where he learned about something called anatomical observation, the radical idea that medical knowledge should be based on actually examining human bodies, rather than simply memorizing ancient texts. Dr. Hartwell has been performing illegal dissections on executed criminals, learning things about human anatomy that contradict everything medieval medicine teaches. The conflict between Dr. Thornton and Dr. Hartwell represents the collision between medieval medical tradition and the emerging scientific method. Dr. Thornton's treatments are killing patients with reliable consistency, but they're based on theories that have been accepted for over 1,000 years. Dr. Hartwell's treatments are producing better survival rates, but they're based on observations that contradict religious doctrine and challenge the authority of ancient medical texts. Dr. Hartwell has made discoveries that seem impossible to medieval medical theory. He's observed that the heart actually pumps blood through the body, rather than the blood being produced continuously by the liver as medieval texts taught. He's seen that women's anatomy is not simply a defective version of male anatomy, as medieval medicine claimed. He's learned that diseases are often localized to specific organs, rather than being generalized imbalances of bodily humors. But Dr. Hartwell's knowledge comes with enormous professional and personal risks. The medical establishment considers his anatomical observations to be heretical challenges to divine authority. The Church views his dissection work as desecration of the human body, which was created in God's image. The guild system that regulates medical practice sees his new treatments as dangerous innovations that threaten the established order of medical hierarchy. The economic incentives that sustained medieval medicine for centuries are slowly beginning to shift. Wealthy patients are starting to notice that physicians who use modern techniques seem to have better success rates than those who stick to traditional methods. Word is spreading through London's upper classes about Dr. Hartwell's unusual treatments and the surprisingly high number of patients who survive them. But the transition from medieval to modern medicine isn't happening overnight, and it's not happening peacefully. Medieval physicians are fighting desperately to preserve their professional authority and their lucrative practices. They're using every tool at their disposal: religious doctrine, guild regulations, academic tradition, and political influence to discredit physicians who dare to challenge ancient medical wisdom. The conflict is playing out in hospitals, universities, and noble courts across Europe. In some places, physicians who practice anatomical medicine are being prosecuted for heresy. In others, they're being celebrated as brilliant innovators. The medical profession is literally splitting apart as practitioners are forced to choose between ancient tradition and dangerous innovation. The patient with pneumonia becomes a test case for this medical revolution. Dr. Thornton insists that proper treatment requires bloodletting, purging, and cauterization according to traditional humoral theory. Dr. Hartwell argues that the patient needs rest, nutrition, and treatments that support the body's natural healing processes rather than attacking them. The patient's family must decide which physician to trust with their loved one's life. Dr. Hartwell's approach seems almost passive compared to medieval medicine's aggressive interventions. Instead of removing blood, he's encouraging the patient to drink fluids. Instead of purging the digestive system, he's providing nutritious foods. Instead of applying hot irons to burn out disease, he's keeping the patient warm and comfortable while monitoring for signs of improvement or deterioration. The difference in outcomes is becoming impossible to ignore. Patients treated with Dr. Hartwell's methods are surviving at rates that medieval medicine never achieved. But more importantly, they're surviving without being subjected to the systematic torture that characterized traditional medical treatment. They're healing without having their bodies attacked by the very people who are supposed to be helping them. The psychological impact of this medical revolution extends far beyond individual patient outcomes. For over 1,000 years, European society has accepted that medical treatment necessarily involves extreme pain, that healing requires suffering, and that physicians have the right to inflict almost unlimited torment on patients in the name of restoring health. Dr. Hartwell's success is challenging these fundamental assumptions about the nature of medicine itself. The social implications are equally profound. Medieval medicine created and maintained a strict hierarchy where physicians held almost godlike authority over patients' bodies and lives. The new anatomical medicine suggests that this authority should be based on knowledge rather than tradition, that medical practices should be evaluated based on their effectiveness rather than their antiquity. As news of Dr. Hartwell's success spreads, other physicians begin secretly experimenting with anatomical approaches to medicine. They're performing unauthorized dissections, questioning ancient medical texts, and developing treatments based on observation rather than theory. An underground network of modern physicians is emerging across Europe, sharing knowledge and supporting each other against the powerful forces trying to preserve medieval medical tradition. The religious establishment recognizes that anatomical medicine poses a fundamental threat to medieval Christianity's understanding of the human body and its relationship to divine authority. If physicians can learn about the body through observation rather than revelation, if diseases can be understood through natural causes rather than spiritual corruption, then the entire theological framework that supported medieval society begins to crumble. But the momentum toward medical reform is becoming unstoppable. Too many patients are surviving anatomical treatments. Too many physicians are seeing better results with observational methods. And too many families are demanding access to medical care that actually helps rather than harms. The 1,000-year reign of medieval medicine is finally ending, but its legacy of systematic torture, disguised as healing, will continue to influence medical practice for centuries to come. The transformation from medieval to modern medicine represents one of the most important developments in human history. The transition from a medical system based on ancient authority to one based on scientific observation. But this transition came at an enormous cost, paid by millions of patients who suffered and died under the care of well-intentioned physicians, who were systematically trained to torture and kill in the name of healing. As you witness these final days of medieval medicine, you're seeing the end of perhaps the most sustained period of institutionalized medical violence in human history. The medieval physician, with his elaborate theories and brutal treatments, is finally being replaced by practitioners who understand that the first principle of medicine should be do no harm. The age of legalized medical murder is ending, but its lessons about the dangers of combining ignorance with authority will echo through medical history for generations to come.